Well, about almost exactly a year ago, I was suffering from really terrible headaches for about 4 months before my diagnosis, and they were just, I couldn't talk, I couldn't really do anything. I just had to go home. One of the times I drove home, I just threw up on the way home. I had to pull over and throw up out the side of the car. This doctor said, "Well, at least we know it's not a tumor." And I said, "Well, how do you know that?" Because I didn't know anything about tumors, so I assumed that he knew more than I did. And he said, "Well, if it was a tumor, you would be in constant pain. And because you're not in constant pain, it's not a tumor." And because it came and went. And so finally, I was going home from work again for maybe the third time that week. And my managers took me aside and said, "This is getting pretty serious. So we went to one emergency room, essentially got turned away, had to go to another emergency room. And I said, I just want you to scan my head. Like, I know something's not right and it's in my head and you need to scan it." And so this doctor was kind of unwilling at first to do that right away. But I said, "Look, I've been coming in for months. It's not a new thing. It's not something we can give 2 weeks and see what happens." And so he agreed, and I went through the MRI and then waited in what seemed like forever. And then he came in and just said, "Sure enough, you have a tumor and there's so much fluid in your brain that we should have had you in surgery, yesterday. So you're going to go into emergency neurosurgery first thing tomorrow morning." And so I alerted my family, everybody came over, and I actually had 2 surgeries. There was the neurosurgery, the tumor resection, and then there was the shunt insertion. So I have a shunt that drains any excess fluid. And so we had to wait for the biopsy results 2 weeks as I was recovering from neurosurgery, which was awful. And we went up and we didn't know if it was benign or terminal, but whatever it was inoperable. So we knew whatever it is, we're just going to have to deal. And so we went up to Spokane where I had the neurosurgery to get the biopsy results. And the neurosurgeon just looked at me and said, "This is going to take your life. I give you 4 to 12 months. I'm very sorry about that." And my mom was fortunately already well acquainted with Dr. Darvish because of her Lyme disease and some other issues. And so the minute I was well enough to travel over the mountains in a car, we were over to see Dr. Darvish. And I started the naturopathic IVs right away. And then I opted to forego radiation, but to do a low dose intravenous chemotherapy. And because of the lower doses, I experienced a lot fewer side effects than anyone else. And then on top of that, I'm doing all the naturopathic IVs, all of the supplements, all of the vitamins, all of those things. And so all together, we think it's working. And all those things just help me maintain. I'm able to live alone with my daughter, which is unheard of with what I have. Most people need a constant live-in caregiver, and I live alone with my daughter and am able to take care of her, get her ready, get her baths, get her fed, barely some days, but still. So some days I need more help than others, but I'm still able to do all those things. And then we just hit last week the 1-year mark of diagnosis, and so that's exciting. We're excited. And then the PET scan shows no active cancer cells. So that might mean there's none left, or it might just mean there's a few left. But because the last couple of days I felt so good. I went on walks, I went bike riding, I cleaned my whole apartment. I went above and beyond. And so today I woke up and just kind of went, well, that was overdoing it. Okay, maybe I should have done a little bit less.
Yeah.
But especially compared to other brain tumor patients, I feel like my quality of life has been spectacular. I do credit a lot of the treatments here. And even my oncologist he believes strongly in natural medicine, said, clearly whatever you're doing is working. And he said, "We're really shocked just by how fast it's shrinking, considering you didn't do radiation." And he said, "That's kind of what baffles all of us." And there was an oncologist at the UW who, said, it's a death sentence. If you don't do radiation, you're going to die. And I went, well, see you later. And that was the last time I saw him.